The United States has announced it will from today be repatriating American citizens stranded in South Africa due to the COVID-19 lockdown. To tell us more, we are joined via Skype by the U.S. Ambassador to South Africa, Lana Marks. Ambassador, thanks for joining us and welcome to Morning Live.
Pleasure. Wonderful to be with you this morning. Thank you so much.
Let's get the numbers from you at this point. How many American citizens are currently stranded in South Africa?
In terms of the repatriation, there will be 1,000 American citizens part of this repatriation. There are 60,000 Americans in South Africa at any one time. And there will be 3 flights from Durban, Cape Town, and Johannesburg, also including Eswatini, Botswana, and Lesotho. 2 flights today and 1 flight tomorrow to Washington, D.C.
Okay, so all leaving out. So just to clarify again, the numbers of those that are being repatriated, how many U.S. citizens exactly?
There are 1,000 U.S. citizens being repatriated on these 3 flights, okay. Yes.
Do the U.S. citizens have to prove that they are coronavirus negative before they get repatriated?
Each of the citizens will be tested at the airport by the South African officials, and we thank the DIRCO officials and the Ministry of Transportation so much for their immense cooperation in assisting with these flights. So they will be tested before they get on the plane, and then once they disembark on the other side, they will have 14 days of self-quarantine as well.
Okay, so it's all the usual processes that have been put in place, very similar to what's happened here in South Africa when citizens have been repatriated from other countries. We understand from the U.S. government website that the flights are not free and that the U.S. citizens have had to pay for them. Can you explain that to us?
They are paid up front by the U.S. government, and then retroactively, each of the citizens have agreed to reimburse at a normal commercial economy fare.
All right. And what about, from the opposite side of the scale? Has any agreement been made to repatriate South Africans that may be stranded in the U.S. as these flights come in?
Yes. I did have a conversation yesterday with the South African Embassy in Washington. And for all intents and purposes, what I believe is they're going to repatriate South Africans stuck in the United States back to South Africa as well. Yes, okay. Indeed.
All right. So that's a positive situation for a lot of South Africans because they stranded there. They have no way of coming back. So these flights may very well be filled with South Africans that can make their way back into South Africa. But I imagine we'd have to speak to our Foreign Affairs Department to find out a little bit more about that.
Yes, indeed. And also, I want to commend President Ramaphosa and Minister Mkhize for doing such an incredible job in South Africa at the moment and being strict. And they're just doing a terrific job.
Yeah. I must say it has been quite incredible to see the world looking in on South Africa and commending our president and the rest of our government for the handling of this. But we'll talk to that in a short while. I would just like to talk a little bit more about these Americans that are being repatriated. Will these be some of the last repatriation flights? And if so, what happens to the Americans who are unable to get onto these flights that perhaps may have tested positive, maybe they are in quarantine or on a short-term working contract or a student? What will happen to them?
As far as Americans who are not availing themselves of these flights, they will be able to take commercial flights when commercial flights resume again. So these are the flights that folks do need to be taking at this time.
And that's so that we'll have to wait and see because, South Africa, in terms of a lockdown, it's scheduled to end next Friday. However, we're all waiting and seeing on the president whether or not this lockdown will be extended.
Yes, indeed. I'm sure he's taking a lot of situations into consideration in terms of how he's going to handle the situation, looking at the world situation, and I'm sure he'll make a very good decision in this regards.
Let's turn our attention now to the United States, and it's a devastating picture emerging every single day. And now the U.S. is the epicenter, with New York City having the most cases of the coronavirus outbreak. The latest figures, perhaps you can update us on those ones. I mean, what we last heard, there were over 431,000 infections and close on 15,000 deaths.
You are indeed correct. And even though there is this bad situation in the United States, I also want to commend our government and Secretary Pompeo for repatriating 47,000 Americans in 454 flights from 74 countries. That's quite an undertaking, though we have such a bad situation in the United States. And we have many specialists working on the situation at the moment. We have Ambassador Birks, who is well known by South Africa, and Dr. Fauci advising the President of the United States, and an incredible team. And they're doing a terrific job so that we reach the top of the curve and then can get this entire epidemic under control.
Yeah, you know, it's been a torrid time for the entire world, but you know, there has obviously been some leaders that have been commended and some that have been criticized. Now, President Trump, unfortunately, has been criticized for his slow reaction to the COVID-19 outbreak, and furthermore, the latest statistics identify that more Black and Hispanic Americans have died. Can you perhaps talk to us about the believed reasons for this?
Well, President Trump has legitimate grievances against the World Health Organization for their very, very slow release of information on this pandemic. It was only, I believe, March 17th that they said it was indeed a pandemic. And had this been done earlier, so much more could have gotten under control. People are scrambling in the United States in every direction at the moment, and everyone is working very, very hard to get this under control. It's not easy. It's a difficult circumstance. It's a virus we've never seen before, and so it's very difficult to deal with.
Yeah, it certainly is, but, you know, mixed messages coming out from, you know, the president at one stage, and we're talking to President Trump at one stage saying that it's just a common flu, it's absolutely fine, don't worry about it, we got it under control. And now sitting at a point where, you know, there are so many deaths, and America is now the epicenter. So, you know, one would look to the US and think that they'd be setting an example of what should be done at a time like this, and yet this has not necessarily been the case. Have you had any sort of information coming from, you know, from the US as to how this should be dealt with and mistakes that have been made in the past in dealing with it?
We do have an organization, the World Health Organization. Prior, when there was an Ebola crisis, there were errors made and they were corrected afterwards. And now we have the situation with coronavirus, something the world has never seen before. Information was given to the World Health Organization in December. They were aware that it was a person-to-person disease and made an initial statement in January, and then very, very late. And the world does look to the World Health Organization for information on these new situations. All I can say is that both CDC, USAID are, through Congress, granting $2.7 billion in aid to the world community for coronavirus. And additionally, the US government are contributing another $500 million to aid the world with coronavirus to get it all under control with all the aid, despite the fact that we have this problem in the United States at this time.
Yeah, even though President Trump has come forward in a tweet saying that he wants to freeze funding for the World Health Organization, to basically quote it, saying that the World Health Organization really blew it, and saying it missed the call on the coronavirus pandemic. So President Trump not being very complimentary on the World Health Organization.
I just think that if they'd announced it earlier, it would have been a much better thing. He has legitimate grievances, and I think the whole world community would have been able to deal with this in a much stronger way earlier had there been an earlier announcement.
I want to talk a little about the financial situation. I mean, obviously here in South Africa, we are struggling with the economy and, talk of negative growth and jobs being lost to many people that are desperate for work and money at a time like this. But if we look to New York, as we mentioned, being the epicenter, this is the financial capital of the USA, and it's now virtually at a standstill. In terms of fears that the US may plunge into one of the worst recessions, talk to us about this. This must be a major, massive concern as well.
I think at the moment it's understandable any country that's dealing with the COVID-19 will have a very, very difficult circumstance with the economy, with all sorts of situations. But the second this is all over with, I anticipate the stock market surging exponentially. It'll be the biggest surge probably in history. I think the economy will get back on track in a way in which we've never seen. And I think things will get back on track quickly. At the moment, it's totally understandable. It's a very, very irregular situation, and it's quite understandable. But it will get under control. We will get to the curve. We will get over this, and our economy will surge again.
Yeah, let's talk about the Center of Disease Control, the CDC, basically recommending the wearing of gloves and masks to protect people from the coronavirus. What is the standpoint on this? Because, again, President Trump saying that he's not really going to adhere to these regulations. What is the American public feeling?
Yes, President Trump's been tested for coronavirus, and he tested negative. In terms of the CDC, they're being very cautious and perhaps suggesting that one self-protects by wearing a fabric mask or an N95, and that people don't quite understand. It protects oneself, it protects the public against that individual person from these droplets going out into the air. But if one is practicing physical distancing 10 feet away from somebody, a mask isn't absolutely essential at that time.
So let's talk about you and your health, because a few weeks ago we understood that you were actually at an event in Florida where several people tested positive for COVID-19. President Trump was also in attendance. You mentioned he tested negative. You then returned to South Africa, and some of your staff members were upset that you may have been exposed to coronavirus, then you self-isolated. Have you tested for COVID-19?
I was tested at the airport when I came in, and I'm negative.
Good.
However, may I just clarify, because it was incorrectly reported, I was open air at an event, and there were a couple of people who tested for it who were in a building not in close proximity to me at all, and I had no contact with them whatsoever. And when I came back, I just thought to practice physical distancing, as I'd been on a flight from Cape Town to Pretoria that was full of folks. Nobody had coronavirus, but I thought out of an abundance of caution, I would do the physical distancing myself and do a self-quarantine out of an abundance of caution.
All right, thanks for the clarification on that one. I'm sure your staff and those that you're around obviously are aware of all of this and know the situation. Let's now give a little bit more information to some American citizens that may be here in South Africa, or even tourists. And how do they contact you if in fact they need to get onto these flights, or they'd like to be a part of it, and this is the first time they may be hearing this information? How do they get in touch with you? What are the steps that they have to adhere to be on these flights, to be repatriated?
Thank you so much for asking that question. I'm enormously appreciative. They should get onto the South African Embassy website right away and inform that they're wanting to get onto these flights. They should fill in quickly the forms that they need to fill in for these flights with all their ID, and they will be included. Even at the last minute, they absolutely will be included.
All right. Thank you so much. Ambassador, the U.S. Ambassador to South Africa, Lana Marks, talking to us from her residence in Pretoria, talking to the repatriation flights for Americans that are stranded in South Africa. They will be taking place today and tomorrow. Please contact the embassy for any information that you need. And if you'd like to be a part of it, you heard from the ambassador, the last minute, even if you need to be there, you can still be a part of that flight. So do get in touch with them. Again, thanks so much to the ambassador for talking to us. Let's take a break here.